Meredith Jolly practices for Nebraska Medicine at the Bellevue Center. She helps with our pharmacy technician skill assessments here at the college. She likes to help with the hazardous drug handling simulations. So some of you who went through my course maybe had her for a small group leader. And Dr. Jolly is a cat lover. So if you are also a cat lover, you have something in common with her. And so please help me. And Dr. Jolly is doing a quick TED-like talk, so a 15-minute talk. So help me in welcoming Meredith.
Thank you, Judy. Can you guys hear her? Can everybody hear me? Go ahead. Is this on? Okay. Okay, so when I offered to speak at this conference, I had no idea what I was going to talk about. I knew I wanted it to be something more like cutting edge and exciting, but as someone who oversees operations at an inpatient pharmacy, cutting edge and exciting isn't really my daily, thing, I guess. But I chose precision medicine because I've always been fascinated by genetics. When I was an undergrad at the University of Nebraska at Kearney, the Human Genome Project was just kind of in its early stages. And as a biology major, we talked about it in several of my classes. But at that time, in the mid to late 90s, medicine and science didn't really know how we were going to apply the information once the human genome was sequenced. So precision medicine is just one of the ways that that information has become applicable. Now, I need to offer a disclaimer. I don't claim to be an industry expert in this topic, but I had fun researching this, so I hope you guys enjoy this high-level overview of the topic. So, disclosure, I have no financial relationships or conflicts of interest to disclose. And sorry, I'm getting over a cold, so try not to cough. So here's our objectives. We're going to define what precision medicine is. We'll discuss some disease states and medications that apply to precision medicine. And then I'll talk briefly on what pharmacy's role is with precision medicine. So what is precision medicine? It's also called personalized medicine, but precision medicine is a more accurate terminology. It combines genetic information with other factors like lifestyle, so maybe the patient's diet, to determine the best approach for a particular patient. Precision medicine tailors medical treatments to individual patients. Now, this can kind of be a misleading statement because every single person doesn't have an individual approach. It's more really for genetically similar groups of people that the approach is tailored, but it's individualized to patients when you combine genetic information with other social factors or lifestyle factors, like I mentioned, their diet, to kind of complete the picture and individualize the treatment for them. Precision medicine is also changing the way we understand and treat diseases. So pharmacogenomics. This is the study of how your DNA impacts how your body responds to a medication. So like I mentioned, there's different genetic groups, and each genetic group may respond to a medication in a slightly different way. So first we need to understand the patient's genetics to develop a treatment plan. And then using genetics, we tailor drug therapy to help maximize the patient's benefit and minimize the risk. So we'll talk about that a little bit later. Precision medicine applications. So genetic information can be used for diagnosis, treatment, or prevention of diseases. So when we talk about prevention, we're using genetic information to predict what the likelihood or risk is for that individual to develop a disease. So most of you have probably heard of the BRCA gene when it comes to breast cancer. So knowing if a patient has that in their genetic makeup will help clinicians determine if that individual is at a higher risk for developing breast cancer, especially at a young age. And then the doctor and the patient together can come up with a plan to help minimize that patient's risk. Other applications are in the realm of cardiology. So blood thinners. You're all familiar with warfarin, and as you guys know from dispensing it, doses change often, right? In the inpatient setting, sometimes day to day. So genetic information can be used to help guide patients' dosing of warfarin in combination with lifestyle factors like their diet to help determine what dose is best for them. Clopidogrel is another one, Plavix. So some genetically different groups of patients metabolize this drug faster than others. So if the drug is not in your system long enough, then that can lead to a treatment failure, which might mean a heart attack or a stroke. So that's definitely, something that we would want to avoid. Some patients also metabolize this drug slower than others, so that can lead to increased side effects or drug toxicity. So if you're metabolizing something slower, then the drug levels build up in your system, and then you can have adverse events like bleeding. Cancer is another big disease state where precision medicine is applicable. We use genetics a lot when it comes to cancer to, like I mentioned, determine someone's predisposition and take preventative measures. So that may mean lifestyle modifications, that may mean closer monitoring. So when we think about having colonoscopies, patients that are at higher risk for developing colon cancer may need a colonoscopy sooner or more often than patients whose genetics indicates that they are not as, at as high of a risk. Using genetics can also help drug researchers design medications that can target certain cancers. Genetic markers on the tumors are used to also select treatment. So if we do genetic testing on the tumor itself, then clinicians can know, what genetic factors are part of the tumor's genes and use targeted therapies to target only the cancer cells and avoid also damaging healthy cells. And this leads to less side effects for the patient and a better outcome. So what is pharmacy's role? So pharmacy can help by using patients' specific genetic information to optimize drug therapy. So optimizing drug therapy is kind of our thing, right? Like that's why we all are in pharmacy. So that can help with drug selection. So maybe clopidogrel is not the right choice for the patient and they need another medication to thin their blood and help prevent heart attacks or strokes. We can also help by guiding dosing. So I mentioned warfarin earlier. Pharmacists often are the ones dosing warfarin, and if we have that genetic information, we can hone in on a starting dose for a patient a little bit better, and that way they can become therapeutic a little bit faster and prevent, hopefully, further trips to get their INR checked or things like that. And then monitoring strategies, like I just mentioned with the INR, it may lead to being able to monitor them less frequently, which will improve their quality of life. So improved outcomes, another way pharmacists can help with that is by identifying antibiotics that are not resistant or are resistant, and then we can change therapy when patients have an infection. And also I've mentioned a couple times cardiac medications and warfarin dosing. So having a patient's INR be in the therapeutic range can help prevent them from having blood clots and adverse effects. So when we prevent adverse effects, this increases the tolerability that patients have on their medications, which leads to higher compliance and an overall higher quality of life for our patients. So having this information at our fingertips will be very beneficial for patients and clinicians to help guide therapy more appropriately. Now, you're probably not seeing this really in practice yet. I think as a whole, medicine is still trying to figure out how to really operationalize this and put this into practice. Some of you may be familiar with the study that Nebraska Medicine is doing right now to gather this information for people that choose to participate in the study. So I think we're kind of on a precipice where we will see this being used more and more in daily practice. Okay, just to sum up what we talked about, precision medicine is using a patient's genetic information to guide treatment decisions. It is applicable in several settings, the most common right now being cancer, but I foresee there will be other disease states for sure on the horizon coming. One of them right now that is starting to emerge is the treatment of depression. So right now, choosing an SSRI like Zoloft or Paxil for a patient is kind of like choosing a warfarin dose. It's trial and error. You try something, you wait a few months, you escalate the dose, and if that doesn't work, then you switch. But having genetic information available may help guide clinicians to be able to choose a better SSRI to get better results for that patient, sooner, and prevent any adverse outcomes or improve their quality of life a lot sooner than we do today. And pharmacists use precision medicine to determine drug selection. So in the realm of cancer, we can help guide based on the genetic information that we have available for what is, showing on the patient's cancer, and help optimize doses based on genetic information on how, we know that a patient's a fast metabolizer or a slow metabolizer. We can adjust doses for that. All right, that was pretty fast. We're ahead of schedule. Do you guys have any questions? Yes.
I would, just speaking generally, so maybe you can guide me. For patients who don't really know what genes they carry,
Yeah.
how do they go into, do they just go into their doctor's office, their PCP, and say, hey, I want to find out what genes I carry?
That would be a good first step. I think right now that kind of screening is not widely offered.
Right.
So that's part of the reason I think Nebraska Medicine is doing the study. So asking their PCP would be a good first step, and they may know, a study or refer them somewhere else. The study here at Nebraska Medicine, it was just a blood draw. Mm-hmm. It's not open to the general public yet, right, but it will be.
Yeah, because I know if you, maybe even get a referral for a geneticist, just for the community that I'm and we even looking for the sickle cell gene. Mm-hmm. That's something that now my generation is looking into so we can help our children. So I'm wondering how we can get, other people to know who they can speak to find out.
Resources in different communities are obviously very different. Right now it's pretty spotty, but as I mentioned, I think, in the next few years we'll see this becoming more widespread. Thank you for the question. Anyone else? Yes?
Is there an optimal age we should start asking those questions? I was along the same line.
The younger the better.
Yeah.
Especially
nice at birth.
Truly, yeah, truly. Especially when it comes to something like breast cancer. People are diagnosed with that in their 30s. I had family members that died from colon cancer in their 40s. So the younger the better, in my mind. Yes.
I know a couple of years ago, my son-in-law, who was only 50, was diagnosed with no symptoms whatsoever. By the time they caught it, it was stage 4.
Is that colon cancer?
It started out actually esophagus,
okay,
and then spread to the liver and then his bones. What's that?
And almost no symptoms.
no symptoms, not whatsoever until it was stage 4. But I know my daughter, when my grandchildren were at the time 18 and 23, I think, she did have them gene tested just to make sure, because there was no cancer in our family whatsoever, you know, my side of the family, but so she did have my grandchildren tested because it just gave her some peace of mind, and luckily there was no gene.
And to your point there, it's not, cancer is not 100% genetic, so there's, you know, obviously environmental factors too, but having the genetic information, especially at an early age, can kind of help people make decisions, you know, throughout their life that they can reduce their risk.
It just gave her the peace of mind.
Yeah, absolutely. The Nebraska Medicine Study currently looks for 2 different types of cancer. Breast and colon are what that study is testing for. Any other questions? Yes.
I actually have a handful of questions.
Okay, I will try.
I'd like to ask questions. So, you said this current study is only on cancer, or is it?
For the Nebraska Medicine,
Yeah.
it also looks at early heart disease too. But for cancer, it's just those 2.
Do you know how far along that study is?
Right now, I believe they're still only taking employees.
Okay.
This summer, they're supposed to open it up to family members of employees, I believe. And then maybe by this fall, don't quote me on these dates, maybe by this fall, the general public.
Okay, cool.
Yeah.
Do you know if it's expensive at this point?
It's free. It's a study, so there's no cost.
Okay, well, but like the cost, like in the future, I guess,
Oh.
genetic testing in general?
Yeah, I'm not sure. I think right now it's probably more expensive because it's newer.
Okay. What else? Going back to Plavix,
Yes.
is there any indication or anything that assists you in determining to get the patient off the medication? Or is there a point where the medication is no longer helpful? Because I don't know, we just had a discussion about this a few days ago with my pharmacist, and we don't really know where to go with that.
In terms of like, just in general?
Yeah,
Oh,
general.
it depends on why the patient is prescribed the Plavix. So some people take it for a very short period of time, like 6 months.
Yeah.
Other people will take it for years or maybe lifelong. It just depends on the patient specifically, yeah.
Okay, cool. That was it, thank you.
Okay, thank you.
What
Yes,
I was
Jessie.
gonna say is the genetic testing open around like October?
For employees?
Yeah.
Yes, I believe so.
Yeah,
Yeah.
it started around
Yeah,
October.
yeah, it was
so
last fall.
It's been a few months
Mm-hmm,
since
Yeah.
it started.
yes.
The basic test with the blood draw is just a straight karyotype.
I'm not 100% sure how they do that. The results were kind of fun though, because we also got our like background information, so what ethnicity we were, and also a handful of other traits, like do you have curly hair or straight hair, things like that that were kind of fun. But I'm not 100% sure. So it's done through a company called Helix, I believe. Yeah. But, and I know others, or some people initially were concerned that this information would be sold to insurance companies or things like that. But since this is part of a research study, it's federally protected information, so it cannot be sold. Yes?
Do you have any other examples of specific medications and how they're adjusting them? Like making it liquid or?
Not necessarily. So it's really more choosing a different medication or adjusting the dose, I guess. Yes.
I can add a little bit of color.
Okay.
I'm on the medication access team here at Nebraska Medicine. I work with the rheumatology team specifically, so they can identify alleles for certain diseases within rheumatology to try and give you the best biologic therapy for that condition. Insurance companies haven't quite caught up yet, so you may have an allele for ankylosing spondylitis, which is like back pain generally, but you may not have true ankylosing spondylitis yet. So we're on the front lines of like bridging that gap and finding what literature is out there that shows the link between like these positive allele tests and then the progression of disease, so that we can fight for patients getting accurate therapy instead of having to go through step therapy that may not be appropriate for what they currently are doing.
That's awesome.
That's amazing.
That is cool.
Yeah, thank you for that comment. Any other questions? All right, thank you, everybody.
Thank you.